Next slide, please. So here's our agenda for today, and we want to be really respectful of your time, recognizing that this is a lunch hour, and also I'm sure that everybody has lots of patients that they want to get in throughout their day. So our presentation will take about 15 minutes with about 10 minutes at the end for questions. Our agenda today includes a brief overview of BenefitBump, the role of the Care Navigator, and then the referral process. Next slide, please. Great. So BenefitBump is a brand new program. You could say that we created this program by parents for parents. We partner with employers to help employees, who we refer to as participants, understand their maternity benefits, which include parental leave, wellness programs, childcare options, and then developing a return to work plan. We work with all parents. In fact, many of our participants are the dads, which is really exciting. I just want to mention that our pathway to parenthood includes 4 major life events. We kind of have it broken down into 4 different events that we, like I said, consider major life events. So they would be planning, infertility, pregnancy, or adoption. And then we're also working on finalizing a perinatal grief and loss module, which we're really excited about. So each life event is broken down to milestones, which includes a really robust checklist of items to help support parents throughout their journey. For example, during the pregnancy life event, the milestones are broken down by trimesters, and each trimester has actionable items. So in the first trimester, one of the items is to register for a healthy pregnancy program. Each participant has a dedicated care team led by a master's level clinician, and then they're supported by benefit and leave experts. Our preferred method of communication is that human interaction. And when we're not available after hours, the BenefitBump app and website are really great resources for our participants to have access to. Next slide, please. So a little bit more about our care team. Each care team offers personalized support that is customized to each participant. So somebody on the journey to adoption, their experience is obviously going to look very different from somebody who is just in the planning stages. Each of our care navigators and our entire team are trained to focus solely on those family maternity benefits. As I mentioned earlier, the care navigator is a licensed mental health professional who gets to know the participant, orient them to the program, and then provide that in the moment emotional support. And we'll dive a little bit deeper into that role just shortly. Our benefit experts are professionals who walk with the participant during, we loop them in if there are any complicated plan details, and we can have them help us understand if there are any big questions. Our leave advocates are experts in local, state, and federal leave legislation, and they can help participants with required paperwork. And our care navigators, they schedule time with each participant to deliver our program and provide follow-up communication between scheduled calls via chat and email. So they'll meet about once every few months to talk about next steps. Okay, next slide, please. So as I mentioned earlier, we have an app and a website, and our main focus is that human interaction. And we do recognize that sometimes those communications between partners regarding major life events tend to happen after hours. So we want to have a tool available at all hours to support our participants and their families through their journey. So the BenefitBump website and the app are great resources to help participants understand or have access to their employer benefits, check off to-do items, or even read helpful resources and articles. They are also able to access having a schedule to schedule time with their care navigator. Okay, next slide, please. So now we're going to dig a little bit deeper into the role of the care navigator. We are incredibly passionate about quality of care, and it is really important to us to maintain consistency throughout the BenefitBump program experience. For this reason, each participant is assigned to one care team, and that relationship will continue throughout the remainder of the program. Our BenefitBump model takes an emotional health forward and personalized approach. Our care team our care navigators are not providing therapy or making diagnoses. They use a client-centered approach to meet the participant where they're at on their journey to parenthood. Each care navigator uses an outline that we call the 5 R's: relationship, reminders, resources, risk, and referrals. We build that relationship and establish rapport to help create trust and respect. We provide important reminders as related to checklist items, or so the participant has an idea of what's to come and that nothing is missed. There are important items related to leave that if they're completed incorrectly, they have consequences and can result in gaps in coverage or even loss in pay. Our care navigators share helpful resources, including healthy pregnancy programs and peer support groups that are available to them through their employer. Using our clinical lens, we screen for signs of emotional discord and complete assessments such as the PHQ-9, EPD, or EPDS. Should a participant show signs of distress or inquire about services, we refer them to a mental health clinician for help, and that's where you come in. Next slide, please. One last note, just to reinforce the care navigator's scope of practice. Even though our care navigators are also master's level clinicians, they are not acting as the participant's therapists. Our care navigators are typically following up with each participant by phone or email every 4 weeks or so, and the interactions with the participant are less frequent than the interactions with their mental health provider. Okay, next slide, please. So 2 questions that come up frequently are, the first, why is our team led by clinicians? And second, why do we want this robust network of therapists interested in supporting this population? So the first question goes back to our expectation of delivering high quality care. The valuable skill set mental health clinicians bring to the table is superior and essential in a service model. The clinician is knowledgeable and building that rapport by meeting the participant where they're at and having a lens to be on the lookout for signs of emotional distress. Knowing what to do next is absolutely critical. Validating that emotion, normalizing therapy and mental health services, and then making that referral. Our goal in building a proprietary and robust network of mental health clinicians across the country is to be that easy button for our participants. We want each of them to have access to high quality providers who specialize in maternal mental health. We believe we would be doing them an absolute disservice if we just handed them a list of names of providers to dig through. And honestly, my guess is that many would not seek treatment if that was our approach. As many fellow parents know, time is incredibly precious. And if we can take one thing off of our participants' plate to add value to their lives, that is a huge win for us. So as this slide shows, you can see that the research is very clear. Mental health, anxiety, and depression are the most common complications of pregnancy and childbirth. 1 in 5 women will experience maternal mental health during their pregnancy or at some point in the first year following. And of those women, 75% will experience symptoms that will go left untreated. I am 1 in 5. And thankfully, because of my training as a therapist, I knew what was happening, and I had the wherewithal to meet with my therapist to work through my postpartum anxiety. Many medical providers do screen for maternal mental health conditions during postpartum visits, but unfortunately, physicians do not typically know how to talk to a patient who may be at risk or are not trained in what to say. We want to help bridge that gap and address any mental health concerns that may arise during pregnancy or adoption, during or after pregnancy or adoption. Next slide, please. So now we're going to dig a little bit deeper into how you can be a part of our network and what the process looks like. So when a care navigator determines a referral for treatment is appropriate, the care navigator will first source our specialized network of providers, and that's you. A search will be conducted by location, whether insurance is accepted, and the area of expertise as related to presenting issues or concerns. The care navigator will then work to determine the best fit based on the search results, and then they will offer to provide a warm transfer for the participant to schedule the appointment. Once the participant is connected to the provider, the care navigator will no longer be a part of that process, and the provider will proceed as usual with their new client. We're striving to make this process as seamless as possible for both the participant and the provider. We are simply serving as that resource to available supports. Next slide, please. So these are some of the questions that have been coming up throughout our process of creating this network. First is the reimbursement rate. We are simply a referral source, so we are not offering any reimbursements. Services will be paid by the participant and or their insurance provider. Another question is, how will my information be used, and what if I have any changes? So we're in the process of creating a geolocation tool to make searching for providers easier. Your information will be kept in the BenefitBump database. If you have any changes to your credentials, your population that you treat, or are no longer taking patients, please contact me or anyone else on our BenefitBump team so that we can reflect that appropriately. What are the next steps for a referral? As I mentioned, just continue as you normally would with your new client. Would I need to submit any information about my client's treatment? Absolutely not. All treatment is confidential. We are not asking for anything. We are simply that referral source. We may ask the participant about their experience to help us refine and improve our network. Another question is, why haven't I seen a referral yet? We're still growing, and it's really possible that you may not receive a referral for a few months, which leads me to the next question: what are the next steps? Our plan going forward is to offer biannual training specific to maternal mental health, and we are hoping to provide CUs. We're working on that. We will also be sending out a quarterly newsletter to give an update on our journey as we continue to grow. So that concludes our presentation for the day. Thank you so much for taking time to talk with us. Now we're going to open if there are any questions that have been coming up throughout the presentation.
Yeah, so a few questions have come up already that I'll kind of pose to Amanda in just a second. Additionally, if you have any additional questions, you can write them in the chat. I just posted a message there. One question that came through, Amanda, is how much information will a provider receive about a participant when they're referred?
Only what the participant is sharing with the provider. So we will not be, we'll just be that, again, that connection. So whatever the participant is sharing with us, hopefully we'll be doing that warm transfer, and then the participant will share that information with the provider.
Hey, Amanda, it's Susie. I'll join in there too.
Yeah.
Some of the basic information we would hand over, of course, participant name, if we can give things of a date of birth, but, and sometimes too, with their permission, we may give you a quick summary too, of just saying, this is from BenefitBump, this, Jane Smith has been working with us, and she just is having some concerns about ways that she's been feeling since having her baby or something along those lines.
Yeah.
So some basic information. If we find out at some point that, let's say, we need to get some type of release of information going and signed, I think we're trying to avoid it being that detailed. We're handing a ton where it's just enough to know that if they're coming from BenefitBump, it's because we're helping them through a pregnancy or adoption. So we can try to let you know at least that much. And then because we would get enough information from them and know enough about that, hey, we've screened for some risk. If we gave them a PHQ or, something along those lines that we know that we're sending them over to because they've agreed that they want the counseling, and we think that it's clinically appropriate to do that. So I hope that helps answer as well. If there's more detailed information that someone's wanting to know that I didn't cover there, just let us know, type it in, or let Kate know, and we'll be happy to address.
Great question.
Two more questions that are kind of grouped together. One provider is asking, will you screen for risk concerns? And then we also received the question, how will BenefitBump handle suicide risk?
So
those are kind of together.
Yeah, so we will be screening for any kind of risks, and all of our care navigators are trained to have that lens to know what to do in a crisis situation. So we kind of have a level of the first interaction of this person probably needs some services, but they're not at a risk for harming themselves or their child, or anybody else for that matter. And then if it elevates from there, then that's when we would bring in like calling 911 to have a well check done on that participant. But yeah, like I said, all of our clinicians are not only have their background from their training, but then are also trained in that crisis management.
Great. So we just had a clarification question, Amanda.
Sure. Yeah.
Clarifying the difference that a care navigator is not the same as a care provider. So they just wanted to confirm that the care navigator is part of BenefitBump, but as providers, they just need to register and there's no additional action at this time.
Absolutely. Yes. Yes. Our care navigators are employed through BenefitBump, and the providers, the mental health providers, are all the providers that we'll be referring to.
Great. And then I think just one more question that has come through so far is, does your team make recommendations about treatment goals or interventions during the referral process?
No, that is because we're not doing any diagnosing or any treatment. That is not within our scope of practice. That is definitely left up to the provider.
Amanda, I'll add in too, though. Let's
Sure.
say, for example, if someone seemed, more at risk and we thought they would benefit from, a partial hospitalization program, we might just go right to that route of trying to see if we could get them to, get to a hospital or loop their doctor and help get them a referral into a hospital program. But other than that, as long as it seems like they're safe or, they're not at an immediate risk of harming themselves or others, and that it seems appropriate for just individual, then, of course, we'll just get that referral right over to you all, the network here.
Yeah, absolutely. Yes. Thank you for adding that.
We have a question about if someone is a part of our this webinar today and has not registered to be a provider yet, how would they go about registering?
That's a great question. So we have a survey. You know what? Actually, we have a survey that we have a few more questions that we sent, the follow-up survey that was sent out that have a few more questions based on, do you have any interest in treating this population? What is your experience? We would ask that you could fill that out so that we can add that information to our database. So if anybody is in that situation, please send myself or anyone in the BenefitBump team an email so that we can make sure to include you in that survey.
Yeah, most people on this call today have already completed that survey, but if you somehow got the email about this, maybe a colleague shared it with you and said, hey, you should join this too, and you haven't completed that survey, go ahead and I'm trying to think of the best way because Crosby's on the call and I don't think it's easy enough for her to just put the survey link in. Maybe we could send something out after this too, to just say, hey, for those that are interested in registering, if you haven't yet, we'll send that survey link out, but certainly feel free to respond to that email that you received and just say, let us know that you need the survey link and we'll get it over to you.
Yes, thank you.
Yes, I can jump in there. We'll send the
Okay.
survey link for any additional providers with the recording, and you can share that with any providers who would like to apply to be in the network.
Okay, great. And I see another, Amanda, I'll help you with the question that's just come in. Someone said, does our program provide the services in other languages? Well, for right now, and Amanda, you can jump in and chime here too. I'm like, we're very early on. We've only had a few because we work direct with employers and then their employees are our participants. So we've only had our first few contracts. So we're a brand new startup. So right now, we are using something you may have heard called Language Line. If we had someone that needed, was speaking a different language, that we would help provide them that same support through BenefitBump in, using that. Our plan moving forward is definitely to hire care navigators like ourselves, Amanda, Kate, and I, that will be bilingual as well, so that we don't have to use Language Line as well. So I hope that I've answered that question. But again, if there was something that I missed in that question, Elizabeth, feel free to chime in and let me know if I missed something.
So it looks like those are all the questions that we have so far. If anyone has any last minute questions, go ahead and type them in the chat. Oh, here comes one. Will you provide contact information so that a provider can update their information? So providing contact information for us. Amanda.
Like for us giving them the participants' information? Is that
maybe it would, wording it this way might make sense. Who and what contact information can a provider contact if they need to update their provider information?
Oh, you can contact me or anyone else on our BenefitBump team. And then in our email, all of our contact information is in there. Is that what you're asking? I saw the know your information.
And also, we plan on annually, kind of, or biannual at least, or re-updating and reaching out to all of our providers, is to say also to all of you of, hey, thanks so much for your participation in our network. And, if there's been any changes to your information, please let us know, because we understand you might be a part of several insurance networks or EAPs, and it's probably hard to let everyone know if you decide to go on vacation for a month. So we want to make it easy for you to reach out to us, to just, Amanda, BenefitBump, or anyone here. But also we're going to we'll make sure to also reach out to you periodically, so that if something did change, you're kind of flagged to let us know.
There's a question about telehealth services, and I'm not certain whether this person is asking whether our BenefitBump services are via telehealth or whether the provider services would be via telehealth. So if the person who asked that question could clarify, that would be helpful.
I mean, I can speak to both. So our services provider, I'm assuming. Okay. So whatever, I guess, whenever the world opens back up, whatever the provider prefers, that's just what we're going to go with. So that's at the discretion of the provider. So if you are feeling ready and wanting to meet in person, then fantastic. And if you're not, that's fine too. And I think depending on where our world goes from this experience, we may leave that up to the participant to, like, whatever they feel the most comfortable with. And that's definitely a conversation that participant and provider can have a conversation about.
All right, well, that looks like all the questions we have at this point.
Okay. Awesome. Well, thank you again so much for being a part of this with us today. I really appreciate each and every one of you taking time out of your day to talk to us and to hear more about BenefitBump. And we really sincerely appreciate you and your willingness to be a part of this network.
And then are we sending out, I can't remember, are we sending out this recorded webinar back to everyone after? So if there's something you missed or you need to reflect again, or you want to, if you know of other providers that you think might want to be a part of the network and you want to send them our way, we'll be sending this webinar recording out. So feel free to send it to any other awesome providers that you know. And we really look forward to partnering together and working with you all.
Thank you so much.
Take care, everyone. Thank you.
Bye.